Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. The chemical in our brain that allows us to have a memory is called acetylcholine. And for brain cells to make acetylcholine, they need a constant daily supply of the nutrient known as choline. Now, many people are not familiar with the nutrient choline, but it's a constituent found in many foods. Yet most people don't ingest a daily amount of choline each day from their diet that's recommended by health authorities, as I will discuss momentarily. Now, research has been showing for some time that suboptimal intake of choline over our lifetime is strongly linked with the development of dementia and Alzheimer's disease problems as we get older. Now, a great illustration of this comes from the famous Framingham Heart Study, which followed a subgroup of their participants totaling 1,400 subjects, where they performed dietary analysis, neuropsychological testing, and MRI studies of the brain. And the average age of the subjects were 61 years of age, roughly. So the results clearly showed that individuals who routinely ingested the highest amount of choline showed better memory on test scores. And their brain MRI findings showed significantly fewer biological changes linked to dementia and Alzheimer's disease. Now, on MRI, the appearance of what's called white matter hyperintensity correlates very strongly with cognitive impairment and brain atrophy or shrinkage. Individuals who had the highest choline intakes showed significantly less of these MRI indicators of brain atrophy and brain degeneration. And this is likely because higher choline ingestion not only increases the amount of the memory chemical acetylcholine in the brain, hence improving memory, but choline is also required to maintain the outer skin of brain cells called the nerve cell membrane. And preserving the nerve cell membrane helps to preserve brain cell integrity, brain cell function, and helps to prevent brain cell degeneration and brain cell death. Now, what's important to point out, however, is that in subjects who consumed a great deal of saturated fat from their diet, the high saturated fat intake negated or nullified the protective effect of choline on memory and healthy brain MRI findings. Thus, the health message is clear: get the choline that you need, and at the same time limit foods that are high in saturated fat, such as beef products, high-fat dairy products like cheese and butter, ice cream and cream, as well as coconut and palm oil, and many pastries that are rich in butter and cream and cheese, etc. And by the way, higher choline intake in the Framingham Heart Study also was associated with lower blood levels of homocysteine. And we know that higher homocysteine blood levels is strongly linked to the development of Alzheimer's disease. So choline helps to lower homocysteine levels because some of the choline that you ingest gets converted in your liver to a homocysteine lowering agent called betaine. Now, along the same lines, animal studies show that choline administration blocks the dangerous buildup of amyloid plaque, which is a hallmark feature of Alzheimer's disease, and it reduces brain inflammation, also seen in Alzheimer's disease, by suppressing the action of inflammation-promoting cells in the brain called the microglia. As such, it can be stated that choline plays a key role in preserving memory and brain health via multifaceted mechanisms. So, how much choline do you need to preserve your memory, and where can you get choline from healthy foods? Well, the recommended amount of daily choline for men is 550 milligrams a day, and for women it's 425 milligrams per day. Now, pregnant and breastfeeding women require 450 and 550 milligrams of choline per day, respectively. Now, unfortunately, studies show that men ingest on average only 380 milligrams per day of choline versus the 550 that's recommended. Women ingest about 275 milligrams a day on average versus the 425 milligrams that's recommended. So day after day, week after week, month after month, year after year, this adds up to suboptimal choline brain concentrations and an increased risk for the development of Alzheimer's disease and dementia, according to emerging studies. So where can you get choline from healthy foods? Well, I've included a complete food list below that shows you the number of milligrams of choline in food, but generally speaking, some of the foods that have a really rich amount of choline would be tofu and other soybean type products, chicken breast, fish, other peas and beans and lentils, nuts as well, low-fat dairy products, non-fat milk, 1% milk, non-fat yogurt, 1% yogurt, cottage cheese as well. The cruciferous vegetables, broccoli, Brussels sprouts, cabbage, cauliflower, a respectable amount there. A potato has 57 milligrams of choline, not bad. And wheat germ is loaded. It has also 54 milligrams in 1 ounce. And the grain quinoa also has 23 milligrams in half a cup. But there's a number of sources. But when you examine the food charts closely, you can see that it can be very difficult to get 450 to 500 milligrams of choline each day from food alone. And thus, the daily average intake of choline across the population is much lower than what's recommended. Now, one convenient way to increase choline intake is what I do, which is to ingest 2 1,200 milligram capsules a day of lecithin. Each capsule of lecithin contains about 160 milligrams of choline, so 2 capsules gives you a big head start at 320 milligrams a day. Lecithin is also rich in phospholipids that are important for brain health, liver health, kidney health as well as the overall health and integrity of many body cells. So I happen to like lecithin. You may want to know that 1 tablespoon of lecithin granules contains 250 milligrams of choline, but lecithin in this form has a very fishy odor and a fishy taste that most people, including me, find to be quite unpalatable. So I would suggest that be cognizant of how much choline you're getting each day from the foods you eat. If you're not getting the recommended amount, then consider including foods that contain more choline and or think about maybe taking a lecithin supplement as I have done. So I've included the main references for this information in the text below. Thanks for watching, and I'll see you next time.